Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. On the podcast today, I'm joined by our deputy editor Nick Bostock to talk about the latest news affecting general practice. Coming up, we're talking about the BMA's decision to re-enter dispute with the government in England, the online access plans that have led us to this point, and what both the BMA and the government have to say about all of this. We'll also be looking at what re-entering disputes could mean for the profession. We're also talking about the upcoming NHS workforce plan, which is due to be published before the end of the year, after the government launched a call for evidence. And we're discussing the BMA's latest survey on the state of GP premises and what's required to fix the crumbling primary care estate. Our good news story this week is about a GP who has been attempting to break the record for running around the perimeter of Cornwall in an effort to raise money and awareness of early-onset dementia. That's all to come on this episode of Talking General Practice. So Nick, it's been quite a volatile week in the world of general practice with an argument between the BMA and the Health and Social Care Secretary, Wes Streeting, really coming to a head. This has particularly focused on online consultations and a new contractual requirement that came into force this week. We've talked about this on the podcast before, but what's going on? Why is the BMA so angry?
What's brought this to a head is a disagreement over the way that a change to the GP contracts being implemented. Back in February or March, when the BMA and the government finalised the contract for the current financial year, one of the changes agreed was that from the 1st of October, GP practices would keep their online consultation systems on throughout core hours. So that's from 8 a.m, 6:30 p.m, Monday to Friday. GP leaders agreed to that change on the basis that safeguards would be in place to make sure that it was safe. But the BMA GP committee says the government has reneged on a promise to put those safety measures in place before this change goes live. I'll explain the difference a bit later between what the BMA wants in terms of safety measures and what the government has offered. Anyway, part of the agreement on practices keeping online consultation systems on all day was that patients would only be able to submit non-urgent requests or queries. As things stand, though, there's nothing to prevent urgent queries from being submitted to. And GPs say that that has massive implications for patient safety, for practice workload, and for the sort of clinical risk that practices face. So GPs have talked about a potential tsunami of extra work because having these systems open all day means that they can receive an unlimited number of requests or queries, whereas previously they were able to switch the systems off for part of the day if they'd hit what they felt was like the maximum number of requests that they could handle. And then because it's possible that some requests could be urgent, practice will have to divert capacity to checking through them all promptly. What the BMA's said is that screening through potentially huge numbers of contacts to look for urgent cases will be like looking for a needle in a haystack of unmet need. And where we're at now is that the government said it's not backing down. It's basically brushed off the concerns that GPs have raised. And as a result, from the 1st of October, as this contract requirement took effect, general practice has gone back into dispute with the government.
You've touched a bit on there about what the government said about all this, but Wes Streeting actually brought it up in his speech at the Labour Party conference in Liverpool earlier this week, didn't he? What did he actually have to say?
As I mentioned, the government has said it's not backing down. But I think the way it's approached this whole situation has been inflammatory. It hasn't given the impression of looking to find common ground with the BMA GP committee or of trying to come to an amicable solution by providing the kind of safeguards that the BMA wants. Wes Streeting in particular has used some really combative language and hasn't given the impression that he's listening to what GPs have got to say or that he's taking concerns raised by the BMA seriously. So what he said in his conference speech was that booking appointments with GPs should be as easy as booking a takeaway or a taxi, which maybe isn't the fairest of comparisons for all kinds of reasons, but it's basically setting up this narrative that NHS access should be as easy as any interaction consumers have with any other service. It's casting Wes Streeting as the champion of that, the guy who just wants the best for patients. And the other part of that narrative is that GPs who aren't happy with this change to online access because of the workload and safety concerns he's sort of suggesting that's not really the motivation. The motivation is just that they're resistant to change. He accused GPs and the BMA, anyone who's raised concerns over these changes really, of being forces of conservatism who just want to turn the NHS into a museum of 20th century healthcare. This isn't the first time he's spoken about GPs in this way either. Only a couple of weeks earlier, he said at a BMA conference that GPs who weren't enthusiastic about having online consultation systems on all day were naive, they were laggards who needed to get with the 21st century, was the phrase he used. Another part of Wes Streeting's approach in his conference speech was effectively to suggest that GPs are being ungrateful, pointed to funding the government's put into general practice in this year's contract, the recruitment of GPs through the additional roles reimbursement scheme. We've given you more money and more doctors. How dare you not be compliant now? So there's been a lot of quite aggressive, arguably threatening language, and nothing really to suggest the government's listening to GPs.
Yeah, also, he didn't really acknowledge the fact that a big chunk of that money that they've put into general practice had to go towards paying increased national insurance costs for employers as well, which many GP practices have found really difficult to cover. Kimberly's not here today, but she went on a visit to a GP practice in West London with the primary care minister, Stephen Kinnock, and some other media outlets. She spoke to Kinnock about the BMA and GP's concerns, and he said he was mystified by the decision to return to an industrial dispute. But that's a bit disingenuous, isn't it?
I think it is, yes. So the big point of dispute is around the safeguards the BMA wants to make it safe to have online consultation systems on all day. I said earlier we'd come on to the difference between what the BMA is asking for and what the government's offering. I think this should make it pretty clear that there's absolutely no way the government should be mystified or puzzled about anything in terms of what the BMA is asking for or what its position is. So the government's saying that there's no problem with urgent requests because practices can just post a message on their websites saying that online consultation systems are not for urgent requests. And as far as they're concerned, it's job done. But the problem GPs have raised is that telling people they're not meant to use the system for urgent requests doesn't actually stop them doing it. Kimberly got hold of a letter that the BMA sent to Stephen Kinnock on the 17th of September. And that letter spelled out specifically what the BMA wants. So, this is a letter they've sent to him. He knows exactly what this says, unless he hasn't read it. It says that online consultation systems need to have free text boxes removed, because if patients have a field in which they can type anything, it's possible to ignore any messages they may have seen previously on the website about non-urgent only, and to actually type something in that is urgent. So they also want a tick box system that means patients can only sort of select from a list of specific non-urgent issues. And if their request is not in one of those categories, ultimately they can't go further and they'd have to ring the practice or come in. The concerns GPs have are quite clear. Like I say, they've been sent in writing to the government. So for Stephen Kinnock to say he's mystified is a little bit of a stretch.
We're actually running a survey at the moment which asks GPs and practice managers for their views on these changes and how it will affect their practice, as well as for their views on industrial dispute. And we'd really appreciate people taking the time to fill this in. And we've put a link to that in the show notes, or you should be able to find a link to it on our website. So Nick, what happens now? GP practices have to do this really, don't they? Otherwise they are in breach of contract as of the 1st of October. And it seems quite likely, with the government being so keen on this and really focusing on general practice access as a key priority, that ICBs will probably be keeping an eye out on things to see that practices have done it. Has the BMA said anything about what practices should be doing now?
The BMA advice is that practices should go ahead with implementing the change, but they feel that practices have basically been put in an impossible position. They have to implement the change to avoid breaching their contracts, despite the concern that doing it without the safeguard the BMA wants could be unsafe. There's been speculation from some GPs that practices may refuse to make the change and breach their contracts, but because of the risk involved in that, I think it's not likely to be a stance that very many, if any, are going to take. You mentioned ICBs. NHS England and the government have made it clear that ICBs will now be looking for practices who are struggling to implement the changes. Statements have suggested that they'll be looking to support practices to do it, But clearly, there is some jeopardy here too, because ultimately practices have to go ahead with this to avoid breaching their contracts.
Right, so the BMA and the GP profession are effectively now in dispute with the government. What does that mean for GPs on the ground? What do you think is going to happen next with all of this?
I mean, in terms of the immediate impact, GP leaders have said there's a chance practices could do things like setting up waiting lists to manage demand. Practices have also talked about the possibility of having to reduce face-to-face access because they may have to divert some of their GP capacity to triaging potentially large numbers of messages received through online systems, and to limit the risk of urgent cases slipping through, as we've talked about. We know the BMA is still exploring legal action to try and force the government to implement some of the safeguards that it wants, or maybe even just to stop it pushing ahead with the contract change without those safety measures or until they're in place. For now, being in dispute basically just means that the BMA will write to the government to confirm that that's the status. But over time, if legal action, talks behind the scenes maybe that are perhaps going on, if those sorts of things don't make any difference, then we could see the profession move towards another ballot. There was a ballot, obviously, before the move to collective action that happened last year. That would potentially look at stepping up collective action that paused with the start of this year's contract. So types of action that don't put practices in breach of contract, which was what they did last year and into the start of this year. But it could also look at tougher measures, forms of industrial action that would breach contracts, things like list closures, refusal to engage with bits of the contract, such as having online consultation systems on throughout the day, or even closing practice temporarily, effectively going on strike. And we know that there's some support among LMCs from LMC's conferences for forms of stronger action. There are also some wider implications too. I mean, the BMA and the government were meant to start talks on a major reform of the GP contract, which they hope to complete within this Parliament around now. Could a dispute derail those talks? What does it mean for GPs' prospects of being given the sort of leading role in setting up their neighbourhood NHS that the government wants to develop? What could the dispute mean for decisions the government makes about funding for general practice, whether we're talking about just the coming financial year or even the longer term, sort of the rest of the Parliament? All of those issues are looming pretty large for general practice behind this immediate confrontation over online access.
Obviously, the current situation has come about on the face of it because of online access, but it isn't just about that, is it? I mean, the BMA had a series of demands that it had put to the government about the future of the profession, and this was just part of it. It's obviously also very unhappy about the 10-year plan and what that could mean for the future of general practice, as we discussed on the last news podcast. So even if the online access issue hadn't come to a head this week, we could well have found ourselves in the position of GPs being back in dispute with the government, couldn't we?
I think that's right. Alongside the access issue we've been focusing on, there's another disputed change that kicked in from the 1st of October. And that's around an IT system that allows information from consultations in pharmacies to sort of flow into GP patient records. That's something called the GP Connect Update Record Write function, which is a bit of a mouthful. And basically the Joint GP IT Committee, that's another mouthful, which is a cross BMA, RCGP sort of expert informatics group, has told the government that as things stand, it doesn't think that system's safe. It doesn't think it's ready to go live, but that's also gone ahead from the 1st of October. We've also spoken previously about a list of demands that the BMA GP committee wanted the government to agree to by the middle of September. They'd said that if they didn't agree to those demands, that could lead to general practice going into dispute. And this was guarantees around funding for general practice in the coming years. It was steps to address GP unemployment, to shift additional roles funding to a practice-based scheme, among other things. None of those things have materialised, so the GP committee could well have ended up going into dispute over those issues too.
What we've seen this week really is just quite a lot of anger, it feels like, from both sides. Obviously, there's the GP committee who really think that these changes are very unsafe, a risk for patients, a risk for GPs. And then there's Wes Streeting basically accusing GPs of being out of touch, not wanting to be part of a 21st century healthcare system. So at the minute, they seem quite poles apart, which is kind of quite a concern when you're about to start negotiating a major new GP contract, I think. Moving on, this week the government launched a call for evidence as part of its work to develop a new NHS workforce plan. Nick, what do we know about that?
Yeah, so the last government published an NHS workforce plan in 2023. The current government said when it was sort of starting to set out its ideas for the health service that it would publish a refreshed workforce strategy as well. And in December last year, the government actually said it would publish the updated workforce plan by the end of this summer. So the suggestion was that it would come sort of a lot closer, on the heels of the 10-year health plan that came out in July. That timeline has obviously slipped. And the government's now saying the refreshed workforce plan is going to come later this year. We can guess from that it's towards the end of the year, possibly even at the end of the year. And as you said, it was only this week that the government put out a call for evidence to give various NHS organisations this sort of chance to provide some input. The call for evidence is framed quite tightly. It makes clear the government doesn't just want to hear what people really think about the workforce needs of the health service generally. It wants suggestions on the workforce that fit with its 10-year health plan, that sort of describe the workforce needed to deliver its 10-year health plan. So it specifically asks for examples of how organisations are delivering already the so-called 3 shifts the government wants to see in the NHS. We talk about moving care out of hospitals into the community, using digital technology more, moving towards prevention. What the workforce needs are specifically to deliver those shifts. So one of the things the government said is that it thinks technology can free up GP time, effectively allow the existing workforce to do more. So not just GP time, but time for NHS staff across the board, quite likely. And it said earlier this year that AI could free up the equivalent of over 2,000 full-time GPs capacity. So the government's promised to train thousands more GPs, but this sort of thinking around the impact of technology could also inform the calculations that the government makes about the future workforce needs of the health service as well.
The RCGP was really unhappy with the last workforce plan, wasn't it? There was no focus on GP retention. The numbers really didn't make sense about the growth in the GP workforce. It was based on a huge increase in the number of consultants and only a very tiny increase in the number of GPs. Wes Streeting actually acknowledged that at the RCGP conference this time last year, that the plan would need to be updated to change this, particularly in light of those plans to move more care into the community. But a week or so ago, the RCGP, along with the BMA, were among numerous organisations to write to the government to complain about a lack of engagement with the professions on shaping this workforce plan, weren't they?
They were, yeah. So, as you said, the old workforce plan suggested a much smaller rise in GP numbers than in numbers of hospital doctors. And the National Audit Office said something along the lines of the plan being built on substitution of GPs by other healthcare staff. And that's basically a reference to the last government bringing lots of additional roles staff into general practice through the additional roles reimbursement scheme, while not really increasing GP numbers. The RCGP and others have been looking forward to a chance to sort of, contribute to this refreshed plan. And as I mentioned, it was meant to come out by the end of summer initially, but last month the BMA, RCGP, dozens of other organisations wrote to the government to say that there hadn't been any opportunity for meaningful engagement towards the development of this plan. So now this call for evidence has emerged, so that's a start. But with the 10-year health plan before it, there was also a consultation process. But then when the plan itself emerged, it contained a lot of surprises, points of significance for general practice. But GP leaders said they hadn't had a chance to see that plan before publication. So organisations like the RCGP will doubtless want more than just a chance to submit a paper to this call for evidence. So let's hope they get that. But they'll want proper conversations with the government as well, rather than just the chance to submit a piece of paper and hope that someone reads it.
I should mention here that on Wednesday next week, we'll be releasing a podcast interview with the chair of the Royal College of GPs, Professor Camilla Hawthorne, where we talk about exactly that point, Nick, and about that workforce plan, what the RCGP wants to see from it, and her views on how the process of developing it has gone so far. So it's worth everyone keeping an eye out for that. Just also to mention that GP Online is the media partner for the RCGP annual conference, which is taking place next week in Newport in Wales. It starts on Thursday, the 9th of October, and you'll be able to read all of our coverage from the event on our website at GPonline.com/RCGP. But, as you mentioned, Nick, retention, I think, will be top of the list of what the college will want to see from that plan, and also numbers. We've heard the government repeatedly talking about recruiting thousands more GPs, but what does that actually mean in figures, and how are they going to do that? I'm sure both the RCGP and the BMA will want to see those details in there. Whether those details will be in there, though, is a big question mark. When we talked on the podcast before about the 10-year plan, I covered off some of the workforce measures in that plan, and some of the things that you were just talking about are technology. They are really important because the 10-year plan says that the use of AI and new tech will mean that the overall NHS workforce doesn't need to grow as quickly as the current workforce plan says it does. So I think, as you said, what the plan has to say about that will be really crucial. How much are they going to lean into AI and tech at the expense of increasing the workforce? Will they get into the figures of how that's going to work and how they're going to quantify? I mean, you mentioned that line about 2,000 extra GPs. So what that was in the plan, I remember that. It was like that was saying that AI scribes in general practice could save 90 seconds on each appointment, and that would generate over 2,000 full-time equivalent worth of GP capacity. But that's just a false figure, isn't it? Practices aren't going to be making appointments 90 seconds shorter because they've got AI scribes. So the use of that technology is not going to suddenly magic up loads of extra GP capacity for appointments. So if the workforce plan is making use of calculations like that, then I think it's going to be problematic for everybody. I think the other thing, we know the BMA says they want there to be enough GPs so we can shift towards a situation where there are 1,000 patients per GP by 2040. And at the minute, that figure's closer to 2,257. So there's a long way to go. I mean, the BMA will obviously be pushing for a workforce boost towards that, I think, in its submission. But will the plan go for that sort of level of workforce growth? Will that be the direction of travel, or will these tech plans mean they're trying to squeeze more out of the existing workforce? And I think one final thing, which I think is going to be key for all of this, is what the plan has to say about physician assistants and what role they should play in the NHS going forward. I think there's lots of doctors who will be keen to see what it has to say about that. Will it still view them as having a big role to play in general practice, given the changes suggested by the Leng review? And if so, how would all that work? The current workforce plan, which you said was developed in 2023 under the previous Conservative government, that envisaged a huge expansion of these roles in primary care. But I think that seems quite unlikely under this new plan.
How the workforce plan fits with the GP contract's really key for general practice. Some of the demands the BMA put to the government recently, as I mentioned earlier, included a call for funding from the existing additional roles reimbursement scheme to shift into a practice level reimbursement scheme and for the creation of a sort of parallel scheme to tackle GP unemployment. The ARS has brought 30,000 staff into general practice. It's staff like pharmacists, physios and others, as well as physician associates. And obviously, the current government has made a big point of the GPs brought in by extending the ARS to cover jobs for newly qualified GPs. And it's now a £1.7 billion a year scheme. And although GPs have long argued that this is funding that ought to be part of core practice funding, instead of split off and shared around at primary care network level, from a government point of view, this is something that's delivered clear results in terms of a boost to the workforce. So will it be prepared to change it? If so, how? Will it keep the ARS as it is for the foreseeable future? Will the government leave PCNs with the freedom they have now to choose which roles to use the funding for, which could potentially drive a shift away from multidisciplinary teams if areas use more of the money to recruit GPs, which they have the freedom to do now? Will the government impose restrictions in some way to deliver a specific change in the workforce, whether that involves more GPs or other staff? So all of that could be influenced by whatever comes in the workforce plan. So there's a lot riding on it for general practice around the workforce and the way some of those funding mechanisms work.
It's been a busy couple of weeks, and something else that's worth talking about is the BMA's latest survey about practice premises. Nick, the BMA regularly conducts these polls, but what did this one have to say?
There are some pretty shocking findings about the state of GP premises. Half of GPs and practice managers say their premises aren't fit for purpose now, and more than 4 in 5 say their premises aren't good enough for the future. More than 80% said they don't have space for extra staff. About 3/4 said they couldn't offer training facilities for new GPs. There were comments about mould on ceilings, plaster coming off walls, cracks in the walls, practice being forced to operate from temporary buildings. There was also a lot on long-standing issues with practices in NHS-owned premises where they've had these big service charges that have left some practices struggling to keep going, so that came up a lot as well. None of this is really new. As we know from Lord Darcy's rapid review of the NHS last year, he pointed out in that the primary care estate was plainly not fit for purpose. That was his phrase. And he said a fifth of GP premises predate the NHS itself, and more than half of practice premises are more than 3 decades old. But what this does show is just what practices across the country are up against when it comes to delivering high quality care for patients. Not only are there problems with staff, with funding and rising demand, all those sorts of things that we talk about a lot of the time that generate pressure on general practice, practices are actually trying to manage those pressures from these crumbling buildings. If the government wants to see general practice get better and deliver the improvements in access that it says it wants, this is going to be a really key factor, improving premises. The government announced a £102 million fund for GP premises improvement in October last year in a budget statement, but that's split now across around 1,000 sites. I mean, initially it was going to be across a smaller number, but they've now said it's across 1,000 sites. So that only comes to about £100,000 per practice, and there's a limited scope to the kind of transformation that's going to deliver. The BMA has said that's effectively a drop in the ocean. We know the government's exploring a revival of public-private funding for premises in some cases, but that looks like it's going to be restricted, certainly initially, to developing new neighbourhood health centres that are part of the 10-year plan vision. But this was a really big survey. We're doing 2,000 responses from GPs and practice managers. And it's important that the government hears what it has to say. I mean, ultimately, we've been talking about the workforce plan, but none of that plan will mean a great deal if there aren't the rooms for those staff to work in.
Yeah, absolutely. It's really not a great state of affairs, is it? But it's not surprising either. We've both been writing about general practice for a really long time, and the RCGP and BMA have released countless polls over the years. I dread to think how many times I've written about this, showing that GP premises are just not up to scratch to deal with the current or predicted demand. And obviously, the real problem behind this is just a serious lack of investment into premises and buildings. The current problems have been years and years in the making. You mentioned that £102 million, but clearly if the government's really serious about providing more care in the community, it's going to have to invest much more than that in premises. There's just not enough room at the moment to house any more GPs, any more staff, any more equipment. You mentioned those neighbourhood health centres, and the government have said it plans to build up to 300 new neighbourhood health centres by 2035, which Wes Streeting has suggested, could be through a mix of new builds, refurbishing existing buildings. But 350 shiny new buildings is not really enough. The government has suggested, as you said, it's going to look at public-private partnership for funding developments, and we're expecting an announcement on that in the budget next month. But that's probably only going to be for these new neighbourhood health centres, not existing premises. And it's also very unpopular. The BMA is very against public-private funding for infrastructure. And it really seems like there's no plan about what to do with the existing primary care estate. But obviously it needs addressing because, as I say, 300 new health centres is not going to deliver a neighbourhood health service. So the government's obviously going to have to come up with a plan to develop the existing primary care estate. Before we go, we've just got time for our good news story, which this week is about GP and ultra runner Dr. Elsie Davis. Dr. Davis was in the national news this week because she is aiming to become the first person to run around the entire perimeter of Cornwall, her home county. She set off from Land's End on Monday this week, heading along the north coast. The total run will be around 400 miles with over 18,000 metres of elevation gain. And her plan was to run just over 60 miles a day, which means she'll be running for around 16 hours at a time. She's aiming to complete the challenge within 1 week. Dr. Davis is running to raise funds and awareness of early onset dementia, which has affected her mum. It's an amazing undertaking and honestly just sounds like a complete nightmare to me, but I think it's amazing. And we've put a link to Dr. Davis's donation page in the notes for this episode, as well as a link to her tracker map so you can see where she is and how she's getting on for the rest of this week. Well, that's it for this week. Thanks so much for listening. I'll be back next week on Wednesday with the first of our 2 RCGP annual conference episodes, which is an interview with College Chair Professor Camilla Hawthorne. And then we'll have a special episode from the conference itself, which will be out on Friday afternoon. So keep an eye out for those. You can also find all of our coverage from the RCGP annual conference, which starts on Thursday, on our website at GPonline.com/RCGP.